Conscious bites. Milk to solids. Part 12.
Do food allergies cause eczema?
That's very much a chicken and egg question. Does eczema cause food allergies, or do food allergies cause eczema? Which one comes first? But before that, what is eczema exactly? Atopic eczema is a chronic inflammatory itchy skin condition that usually develops in early childhood. The strongest theory that we have as to the reason why someone suffers from eczema is that they have a compromised integrity of their skin barrier. If we were to imagine that the skin was like a brick wall, so the wall or a healthy skin barrier is well hydrated with water and protects the body from potential allergens. A poorly working skin wall or skin barrier means the skin is very dry, causing the cells to shrink and forming gaps, which results in poor skin integrity. We also know that eczema is a complex condition and its cause and developments are thought to be multifactorial, which include a genetic predisposition, the dysfunction of the skin barrier, environmental factors such as exposure to pets, house dust mites, pollen, and an immune system dysfunction where food allergies are thought to play a part. Once the skin becomes irritated by possible triggers, the skin becomes itchy and inflamed. A dry skin is more likely to become irritated than a healthier skin. Research has found that babies who have severe eczema when they are under 3 months are more likely to have a food allergy. The earlier the eczema starts and the more severe it is, the more likely your child is to develop a food allergy. The food allergies are triggers which can exacerbate the symptoms of eczema. Once a particular food is found to make the eczema worse, then avoiding that food may improve symptoms, but it won't cure it. A nutritious, well-balanced diet is important in children with eczema to keep the skin and body as healthy as possible. It is important not to restrict a child's diet without clear benefit to their eczema, as restrictive diets can harm a child's growth and development. The most common foods children with eczema are allergic to are eggs, milk, and peanuts. Allergy can occur to many other foods, including wheat, fish, shellfish, tree nuts, soya, lentils, strawberries, and other fruit. There are other foods that can aggravate eczema, such as citrus products, example, orange juice, colorings in foods, chocolate, tomatoes. Some of these foods aggravate eczema due to chemicals such as histamine, which are found in the food rather than due to allergy. Tomato sauce has been found to irritate the skin around the mouth as a result of direct contact with the skin. It's found that limiting these foods rather than avoiding them completely is sufficient, as long as they do not cause immediate reactions.
What if my baby is not allergic to a particular food, but I suspect a trigger for a flare? What's the best thing I should do?
It's quite difficult to work out which foods are causing a flare in eczema, as it takes up to 1 to 2 days after eating the food before the eczema flares up. If there is a combination of other factors, such as altered bowel habit, constipation, diarrhea, or vomiting, may indicate food does have a role. A reliable way of knowing whether a food allergy is aggravating your child's eczema is to completely avoid the food for 4 to 8 weeks. At the end of this period, you let them eat the food again. If your child develops a flare-up of the eczema 1 to 2 days after eating the suspected food, then this is a fairly reliable guide that your child's eczema is being aggravated by that food. It is helpful to keep a food diary or regular photographs of your child's eczema before, during, and after the food is withdrawn and reintroduced in order to help you decide whether it actually made a difference. Remember that eczema is a condition which tends to go up and down of its own accord, so deciding whether avoidance has made your child's eczema better or not can be tricky. If your child develops immediate symptoms such as swollen lips or wheeziness with certain foods, then you should not reintroduce food on your own. Seek help from your doctor or nurse. If your child develops eczema after 2 years of age, then food is less likely to be important when other environmental triggers become more significant.
So how do you treat eczema?
Doctors prescribe a generous amount of emollients and advise frequent and liberal use. The emollients provide a barrier on the skin from potential allergens for both acute flares and remission of eczema. Steroids are considered for red, inflamed skin. Some children may be prescribed antihistamines to help relieve itching and antibiotics in regards to infection, and some children may find relief in wet wraps.
Can I help my child in any way with food?
Children with eczema need a nutritious, well-balanced diet to allow the skin to heal. It is recommended that all children under 5 years take a multivitamin preparation. This is particularly important for children with eczema. Having low iron in the body causes itching and seems to be common with children with eczema. So increasing iron in the diet with green leafy vegetables, red meat, pulses and eggs is advised.
Miss Dietitian, how do I distinguish the difference between vomiting and reflux?
Hi, I'm Miss Dietitian from Conscious Bites. Hope you enjoyed this episode. Please leave comments below and don't forget to subscribe. Follow us on Facebook, Instagram and Twitter. For more information you can email us or check out our website. Bye!